In the late winter, early spring, it can account for 5 to 10% of all the respiratory infections that we diagnose in the United States. So it's definitely out there. Typically, individuals will progressively feel worse with runny nose, maybe a sore throat, some slight body aches, perhaps a cough. The symptoms are not typically as severe as other respiratory viruses like RSV or especially influenza. So human metapneumovirus is transmitted in a similar way to other respiratory viruses like the flu and COVID and RSV, mainly through respiratory droplets that are produced while an individual coughs or sneezes. It can also be spread through what we call contaminated fomites. So if an infected individual coughs into their hand and then touches a door handle, another person could come along, touch that door handle, and then self-inoculate the virus into their eyes, nose, or mouth. And that's a potential way of transmitting the virus as well. So if you would happen to go in and see your family physician with a few days history of a sore throat and a cough and a runny nose, and you were ultimately diagnosed with human metapneumovirus, they wouldn't be able to prescribe you a medication or an antiviral. They would typically just recommend supportive care. So if there's medication that you can take to reduce any body aches or reduce a fever, staying well hydrated. So really it all comes down to supportive care rather than a specific drug to target the virus.